Chapter 10 Key Terms. Palmograph reflex appears at a utero as early as 5 months. It is when the palm is stimulated and all four fingers of the stimulated hand flex or close. So it's pretty much when a baby grabs your finger. Crawling reflex. Observed from birth through the first to 3 to 4 months of life. To elicit this reflex, the baby is placed prone on the floor or the table. The soles of the feet are stroked alternately, causing the legs and arms to move in a crawling-like action. It disappears roughly around 3 months. Startle reflex. Similar to Moro reflex, it can be elicited by a rapid change of head position or striking the surface that supports the baby, causes the arms and legs to flex immediately. It's normally suppressed by 1 year old. Moro reflex. Most useful for diagnosing the infant's neurological maturation. Birth to approximately 4 to 6 months old is when it is mostly seen. You place your palm under the baby's head, then gently lower the head a few inches. The stimulus causes the baby's arms, fingers, and legs to extend. It causes the limbs to extend immediately. Search reflex. In conjunction with the sucking reflex, it helps the infant locate the source of nourishment. Then the sucking reflex enables the baby to ingest the food. Rotation of the neck often elicites off other reflexes, such as your head and neck reflex, head and body reflex, things of that nature. Symmetric tonic neck reflex. The limbs of this reflex move symmetrically. You place the baby at a supported sitting position. You tip the baby backward far enough, the neck eventually extends, which is the stimulus for a corresponding extension of the arms and flexion of the legs. If tipped forward until the neck is fully flexed, the arms and the legs extend. Swimming reflex. Most unusual infant reflex. Involuntary swimming like movements can be elicited days after birth. Response to the stimulus in the arms and legs, moving in a well coordinated swimming type action. Parachuting reflexes. Related to the attainment of an upright posture also. It occurs when the infant is tipped off balance in any direction. It occurs at 4 months, persists past the first year of life. It's pretty much when an infant or even an adult attempts to break or fall, we try to catch ourselves. Labyrinthine reflex appears at approximately 2 to 3 months and it lasts throughout the first year. It is critical to the attainment of upright posture also. It's characterized by the head tilting in one direction, opposite the direction that the body is tilted. Sucking reflex appears very early in life. Babies are often born with sucking blisters on their lips. The sucking response is elicited by lips being stimulated, such as by the touch of a mother's breast or a finger or a bottom nipple or a pacifier, things of that nature. Asymmetric tonic neck reflex is referred to as the bow and arrow position commonly seen in premature babies. Head is turned to one side or the other, and the limbs on the face side extend while the limbs on the opposite side flex. Rare in newborns, but seen in babies up to 3 months. Lifespan reflexes are the reflexes that we endure throughout our lifespan in normally healthy individuals. Postural reflexes are related to the development of later voluntary movements. Palmar mental reflex is elicited. It's a facial response when the basis of the palm of either hand is scratched. This scratching causes the lower jaw to open and close. Palmar mandibular reflex is also referred to as the Babkin reflex. Present at birth, disappears around 3 months. It's elicited by applying pressure simultaneously to the palm of each hand, eliciting all or one of the following responses. The mouth opens, the eyes close, the neck flexes, and the head tilts forward. Stepping reflex, also called the walking reflex. It's elicited by holding the infant upright with the feet touching a supporting surface. The pressure on the bottom of the feet causes the leg to lift and then descend. It's present during the first few weeks through about 5 or 6 months. The stepping reflex is really fun to watch because, it looks like the kid is trying to take off, but they're really not going anywhere. Plantar grasp reflex is from birth through first year. The reflex is evoked by applying slight pressure, usually with the fingertip to the ball of the foot, causing all the toes on the foot to flex. The toes curl around the stimulating object as if it is attempting to grasp, as in the palmar grasp reflex of the hand. Primitive reflexes appear during gestation or at birth and are suppressed by 6 months. They occur in all normal newborns. It is when the infant reflex is usually used for predominant protection, nutrition, or survival. Babinski reflex, evident from birth. It's when the bottom or lateral portion of the foot is stroked, resulting in a downward turning of the great toe and sometimes all of the toes on the stimulated foot. Is the faithful test of the pyramidal tract. Subchordal means below the level of brain. Stereotypies was a study by Lori. Other groups of movement, also characteristics of infancy. They believe that these somewhat usual movements are inherent and crucial to the life of a healthy child, as found in increasing numbers of stereotypies in children who had less than normal control over their own movement. Pull-up reflexes, also related to the attainment of upright posture, observable until the 3rd month, disappear by the 1st birthday, elicited by placing the infant in a supported standing position, holding the baby's hand, one carefully tips in any direction. The stimulus makes the supporting arms flex or extend in an apparent effort to maintain the upright position. And last but not least, head and body righting reflexes, related to the attainment of voluntary roller movement, observed as early as the 1st month, and it disappears by the 6th month. It is elicited by turning the baby's body in either direction when the infant is supine. The head responds by righting itself with the body. And that is all for Chapter 10, Key Terms.